ethics হচ্ছে one is terminology that comes from many things, from Lao Tzu, from Chinese to Aristotle to Immanuel Kant, from Upanishad, everywhere, please do not harm. Do good, but do not harm. That is ethics. So, as a medical student, when you are going to treat a patient, what should be in your mind? To treat the patient with all my prudence, all my, yes, sure, all my prudence, all my knowledge with honesty and morality. Upholding one thing, upholding the dignity and the interest or the what patient wants. আমি চাইছি যে আমাকে এই অপারেশনটা তুমি আমাকে করো না. Do you understand Bengali? If anyone is unable to understand Bengali, please raise your hand. There is no problem. কিন্তু আমাকে তাহলে কম্প্যাশনেটলি তাকে বোঝাতে হবে. I have to make him understand that this is necessary. Because if you do not go for this operation or do not treat you, that may do this harm. You have to be compassionate enough and you have to gain the trust of the person. Understand? This is the basics of কোথায় গেল গো ওটা ওই যে তা ethics governs the behavior, professional behavior in medicine. Medicine is a পারবে না এদিক থেকে এদিক, everywhere there is a medicine. As a medical student, you know, from anatomy there is a dignity of the dead body also, there is a dignity of the cadaver also. Understand? So dignity, so this is the professional behavior. The professional behavior, you should have to be professional enough to make yourself in such a way to gain the trust of the patient. One is compassionate hand. Have you heard the term compassionate hand? If you place, when everybody in your childhood had fever, when your mother put her hand on your forehead, how did you feel? Is it bad or good? If good, then raise your hand. It is very good. That is known as compassionate hand. When you will put the hand on the patient's forehead or when you are going to feel the pulse, your hand should be like that. Because there is many girls here, sorry to say, they know the difference between a good touch and a bad touch. Understand? So that touch should be like that. By the virtue of that touch, the patient can rely on you. Not only, what happened? You have to gain the, yes, no problem. You should not be sorry for the late coming. When the professional behavior is there, so what should be your aim? The aim is should ensure patient well-being. Patient well-being means what the treatment, what are the individual treatment, what can do mostly best for the patient. Understand? Second, the dignity. You should not expose a private part of a patient in front of, in public or in front of a non-medical person. Understand? You have to give dignity to the patient. If the patient wants to tell you some, very, please, that the history which should not be disclosed to others, it is your duty to gain the trust that it will be confidential. So you have to give the dignity of the patient. Understand? Last, the trust, what I have already told you, you have to gain trust by virtue of your behavior, by virtue of your communication skill, by virtue of your empathy, by virtue of your compassion. Okay? এখন অবধি সবাই বুঝেছো? যদি না বুঝে থাকো, just raise your hand. So this ethical practice, if you do the practice ethically, that underpins the medical care everywhere. And it, one hand, it for your safety and mostly for the safety of the patient. Understand? And ethical challenges now come to the point. This my point is the ethical aspect in anesthesia. The ethical challenges arises in anesthesia due to vulnerable patient conditions or vulnerable patient population. What is vulnerable patient position or population? মাথা নাড়বে না, যদি না বুঝে থাকো হাত তোলো, আমি বলে দিচ্ছি। কেউ বুঝেছো? বোঝনি? ধরো একটা এমার্জেন্সি হলো, একটা রোড ট্রাফিক অ্যাক্সিডেন্ট হলো, 4টে পেশেন্ট একসঙ্গে এসছে, তাহলে প্রত্যেকের সঙ্গে তুমি তাড়াতাড়ি করবে? অপারেশনে 4 জন মিলে নামবে, তাদের সঙ্গে তো 1 ঘন্টা কথা বলতে পারবে না। তাহলে এটা ভালনারেবল, অজ্ঞান হয়ে আছে, তাকে তুমি বোঝাতে পারবে না তোমার ইনটিউবেশন না ট্রেকিওস্টমি কোনটা দরকার। ঠিক তো? তাহলে এই ভালনারেবল পজিশনে আমরা কাজ করতে হয় অ্যানাস্থেসিয়া। ভালনারেবল, আর একটা ভালনারেবল, ডিউরিং অ্যানাস্থেসিয়া পেশেন্ট ইজ আনকনসিয়াস, ক্যান নট অ্যাডভোকেট ফর হিমসেলফ। ও বলতে পারে না যে তুমি আমাকে এই করো, হি ইজ আন্ডার অ্যানাস্থেসিয়া, হি হ্যাজ গট নো কন্ট্রোল ওভার হিজ সেরিব্রাম, তাই তো? ঠিক বলছি তো? So ethical obligation to uphold patient safety and autonomy. What do you mean by autonomy? Autonomy is the patient desire, what patient wants. If you are posted for an operation on hand, that can be done under sedation, that can be done under local anesthesia, that can be done under regional anesthesia, that can be done under general anesthesia. Being an anesthesiologist, it is my duty to explain you all the pros and cons, every risk, every benefit of every procedure. Now, if you refuse, I told you the best is general anesthesia with a regional block. But you refused general anesthesia. So, what should I do? Should I anesthetize him? What is the answer of this, of you? Yes or no? No. So, I have to uphold the autonomy of the person. Good. The ethical practice, this if you do, you have to take the consent. I am not going through the informed consent and all those things, that is a very long chapter. That prevents your professionally the legal consequences and the professionally the problems. Understand? There is some key theories in the decision making. I am going through that. The first is utilitarianism. Utility কোথায় তুমি কি রকম তোমার ইউটিলিটি আছে সেটাকে তুমি ব্যবহার করবে। The greatest good for the greatest number. You have to see your resources. You have to see, let us see, there is a mass casualty. So, have you gone through triage or something like that? Do you know? Red label, blue label, green label. If a patient is going to die, and if a patient is bleeding, if you can stop the bleeding, for primary, there is a color coded, okay. And if that patient needs immediate surgery, so you have to do triage. So you have to reallocate or redistribute your resources like that, so that greater population can get greatest benefit. Already I told you the guide resources allocation in emergency, that I already can sometimes, and now conflict arises. What the patient's autonomy? I do not know whether the patient have in a position whether he has got previously given the order of DNR, do not resuscitate, or previously give the order of do not transfuse in any blood. If an unconscious patient, then we have to take the history as soon as possible, as brief, if there is patient's autonomy is there, whether he desires something or something like that. Understand? Okay. Should I go to the next slide? Then deontological ethics. Deontological ethics means duty-based ethics. You can come closer here, no problem. The duty-based ethical framework. The focus is on following professional, I am going to tell you the following professional obligation regardless of consequences. The example, respective a patient's DNR order despite potential life-saving measures. If I have a band in my hand, do not resuscitate me in any condition. If a patient had a cardiac arrest in the ICU or the general ward, should you give CPR to the patient? Yes or no? Jore bolo. Be loud. Always be loud. In your examination also, the examiner will talk with his fellow and will take some kazus and kismises. If you are not louder enough, clear enough, he or she will not hear you. So be louder. So, the last example, respecting a patient DNR order, should you resuscitate the patient in the ICU in spite of having every resources? No. So that is autonomy. Understand? So this is the principle. What are the principles? Just autonomy, I already have told you. What is autonomy? Respect of patient decision. The first thing, respect of patient decision. You always respect the patient decision. Understand? You are going to be a doctor having the MBBS degree with, do you know the greatest degree inferred to you is having the right to write the death certificate. Nobody has till date is not able to write the death certificate without having an MBBS degree. So anyway, autonomy, that respect the patient decision. That was discussed already. If there is any doubt, Just raise your hand. Understand? Patient, yes. কিন্তু পেশেন্ট যদি আগে থেকে বলে রাখে যে আমাকে রিসাসিটেট করো না, তুমি করবে না। না, ডিপ্রেসড। এবার তোমাকে এই কারণে পরে আসছি। এরপরে এথিক্যাল সেল আছে, লিগাল সেল আছে। পারসন উইথ, ইফ নট সাউন্ড, mentally sound, he cannot give the will. Understand? If a psychiatrist says he is not in a give the autonomy, any will, you are not allowed to do that, then you have to call the legal cell, you have to call the ethical cell also. There is ethics committee, there is a legal committee, you have to do a board. Understand? Then beneficence. Beneficence means যেটা করব ভালোর জন্য করব, at the best what resource I have, I will use that for the best of the patient. Never I will go back or go away or হাওয়া হয়ে গেলাম। হাওয়া হয়ে যাওয়া জানো তো, আরে ওখান থেকে কেটে পড়লাম, প্রথমেই কেটে পড়লাম। By the way, if you take, when you will get the degree, if you take a responsibility of a patient on the way, you have to you have to be present there till you hand over the patient to another doctor. So it is your social responsibility and medico-legal responsibility. Understand? Non-maleficence means please do not do any harm. From Veda to Hippocrates to now our Ayush Sanghita, no? Everywhere, please do not do any harm. From Confucius to Immanuel Kant. And justice. What is justice? A patient from a very, let me see, one of the best known, Amitabh Bachchan and Riksho Pullard. Being a doctor, both will get same treatment from you. You should not discriminate between the two. One is one of the biggest, icon of our India, and one is a lesser known, rather not known person to you. But the two persons should get the equal treatment. That is justice to the patient. Shall I go to the next slide? That is virtue ethics, one of the most important thing in medical life. That is virtue ethics. The focus on moral character and professionalism. What is moral character? It is a very vast subject, but you should make yourself that nobody can raise your finger that the doctor is doing some molestation or doing some bad thing. Understand? Moral character, everything you know, I am not going to tell you. The morality, you have to be সৎ হওয়া, নিজের কাছে সৎ হওয়া। বুঝতে পেরেছো তো? নিজে কতটা আমি সৎ, সেটা হচ্ছে মরাল ক্যারেক্টার। আমি দুটো সত্তা থাকতে পারে। আমি যখন ডাক্তার তখনের যা সত্তা, আমি যখন বাইরে তার দুটো সত্তা থাকতে পারে। আমি বাইরে আউটসাইড বাইরে গেলাম, বেড়াতে গেলাম, সেখানে আমি যাকে সেটা আর কিছু বললাম না, সেখানে বন্ধু বান্ধব হই হই করলাম, সেটা আলাদা ব্যাপার। কিন্তু when you with your uniform, I came here with this because this is my identity. When you go to the world with your uniform and this identity card, you have to be moral to the patient. Okay? Got it? তোমার বুঝতে কোনো অসুবিধা হচ্ছে? যদি হয় আমাকে বলতে পারো, কোনো অসুবিধা নেই। এই যে আগেই বললাম, কম্প্যাশন, অনেস্টি, ইউ শুড বি অনেস্ট টু ইয়োর সেলফ অ্যান্ড টু ইয়োর পেশেন্ট অলসো। আমি জানি না, তুমি যদি মনে করো যে আমি দেখুন আমি এটা ধরতে পারছি না কি হয়েছে, you should be honest enough to tell the patient that I want to have a specialist opinion for that. I am giving you the primary care, but I am calling the senior or my colleagues who can treat it better. And you should explain the matter to the patient or the surrogate. Surrogate means? Surrogate means? Yeah, the accompanying person. Wow, very good. Few with a very few bucks. Isn't? Please be seated. Entirely market is known for that. There are at least 20 or 30 tailors are there with the machine. You can give and they will give it tomorrow with all the cards you want. With a very few that will in a big tailoring house that may cost 2,000, they will do it in 300. Am I right? Bas. So all dresses is made by them. Some. Okay. Integrity means সেই একই জিনিস, সততা। বুঝেছ তো? You know integrity. Integrity, you have to be সৎ নিজের কাছে, তোমার পেশেন্টের কাছে। Next slide. The common dilemma faced in anesthetic practice, I am going to tell you. Patient must understand the risk and benefit of the anesthesia, must understand. What I am going to give, what is the procedure of anesthesia, what are the risk of this, what are the risk of that, you have to explain thoroughly to the patient or the surrogate. You can question me, sir, what if a patient came in a bleeding, severe major trauma without any, the good Samaritan brought the patient to the hospital. You have to do a OT immediately. What should you do? That is known as implied consent. For the sake of the patient, you have to, without any consent, we can, being a consultant, with a surgeon consultant, the patient needs immediate operation. That is the implied consent, that is legal. Though in our country, if the patient dies, you can see the consequences in everywhere. Challenges in emergency, already told you. In pediatric patient, because most of the pediatric patient do not say anything, their mother is and cannot give valid consent till the age of 18. The surrogate, either parents or the surrogate, will give the consent, you have to give all those things. And one terminology is that assent, the consent and assent. Consent means the patient who is in the age group and mental status, with a sound mental status, can give the consent is the consent. But the minor, you can involve 18 years, 14 years or 16 years person, child. You can ask the child to be in the part of the discussion, and he or she can decide which he or she wants. That is known as assent. Okay. Oh, sorry. Another is geriatric patient and the language barrier. If I go to Tamil Nadu, on the interior of the Tamil Nadu or in the south, they do not know Hindi, do not know English. I am not able to say anything. Then I have to, if able, I can use the sign language, only thing. Bas, that is the language barrier. The person who came outside Bengal already have faced the language barrier in the early stage. Is it, Miss Maharashtra? Yes, sir. The second is anesthesiologist. They are handled with sensitive information. Nowadays, for all are adult enough, so there is a single mother. They will say you, I am carrying, but you should not disclose it. Anesthesia may harm the patient, but she needs appendectomy. What should you do? So you have to disclose the patient or that issue that she is carrying or not. But in the legal paper, you have to take the consent that, but you are not able to, you should not disclose that this is the fact. Understand? Am I able to make you understand? Okay, no problem. Then ethical duty to patient, privacy. Already I am told you, whether in a OR, whether in an anesthetized patient, whether in a sedated patient, you should not breach the modesty and the privacy of the patient. You should not discuss about or breach the privacy of the patient. Understand? Especially whoever is there, you are not able to ask a patient, go there and show your private purse in a male patient, because you have to give a barrier. Understand? The last is ethical dilemma. End of life care and DNR, already I have told you. What you will do? Will do CPR? No. Because if you do CPR, then you will breach or you will not giving dignity to the autonomy of the patient. Understand? So, required consideration policy for surgery you have to also take. already told you the implied consent in surgery, emergency. Acting the best interest of the unconscious patient, I already have told you in the case of scenario regarding emergency or casualty, mass casualty, and ethical and legal consideration already told you. Parental consent versus child's best interest. If a person, if I am my child have to go through an operation, but I don't want a general anesthesia. But he has to open the thorax. If the thorax cannot be opened by regional anesthesia, there is many problems. So you have to be compassionate, empathetic and all those things to make the surrogate or the parents regarding the consequences and the risk. And one patient, Google, especially the Google reader, the once in a 4 lakh person, there was a death in a child during anesthesia. Yes, this is statistics, but rest of the patient was well. To make them understand. Okay? Geriatric, the decision making capacity is not there. Advanced directive and risk benefit ratio you have to balance. Pain relief. The most critical part in medicine and most ডাক্তারবাবু যাই করুন ব্যথাটা কমিয়ে দিন। কে কে শুনেছো এই কথাটা? খুব ব্যথা ডাক্তারবাবু, আর একটাই হাত উঠছে, আর কেউ শোনোনি? ডাক্তারবাবু খুব ব্যথা, একটু ব্যথাটা কমান। কটা হাত তো একটু ভালো উঁচু করে বাস। তাহলে ব্যথাটা দ্য গুড, তাহলে ব্যথাটা কমানো হচ্ছে যখন নিজের মাথা ব্যথা হয়। আচ্ছা, হোয়াট ইজ দ্য গুড অ্যাসপেক্ট অফ মাথা ব্যথা, হেডেক? টেল মি। হ্যাঁ, that means you have head, otherwise you don't have an headache. Okay. So balancing, if you give opioids, that may cause addiction. Already you gone through the pharmacology, a single dose of opioid can cause addiction. So you have to balance if there is severe pain, you have to use opioids or opioid substitutes or multimodal or regional or something like that, TENS and others. You have to think about that. What facility you have, what resources you have. One of the priority is to reduce the pain of the patient. Okay. Second, already, while management pain effectively. You should not make the patient addictive to opioids or all those things. Now these are the under narcotic control drugs, opioids and all those things. কোথা থেকে আসে opioid? Papaver, somniferaum. What are the কি আছে? Thibetin, এগুলো তোমাদের 4 quadrant মডেল। শোনো, এথিক্যাল ডিসিশন মডেল এই 4 quadrant মডেলের মধ্যে আসে। 4 quadrant মডেলের মধ্যে ফার্স্ট হচ্ছে যে মেডিকেল ইন্ডিকেশন। হোয়াট ইজ দ্য মেডিকেল ইন্ডিকেশন অফ ট্রিটমেন্ট? Patient, everything you get, this is the medical indication of the treatment. Second is the choice of the patient. Understand? Indication. What is the condition of the patient? What is the condition what the patient, which treatment patient needs. Okay. Now the patient preference. Patient which the patient needs. If the patient is able to talk and all those things, you have to give that, you have to have a discussion. If the patient is unconscious, the surrogate or the, what should I say, the guardian, you have to discuss it with the guardian. Third is the quality of life. PQLI, have you gone through PSM? No, not yet. Physical quality of life index, activity of daily life, এগুলো আসবে তোমাদের। হ্যাঁ, আমি বিছানায় বেডরিডেন হয়ে ভেজিটেটিভ হয়ে শুয়ে থাকবো, কিন্তু বেঁচে আছি, শ্বাস প্রশ্বাস আসছে। সে এই অবস্থায় বিং আ 67 years old, আমাকে যদি বলে ইউ হ্যাভ টু, তোমাকে আমি দুখানা পা দুটো হাত কেটে একটা কবন্ধ বানিয়ে শুয়ে রাখবো, তাহলে তুমি বেঁচে থাকবে, তাহলে আমার কোয়ালিটি অফ লাইফ কি ভালো হবে? হবে না। তার চাইতে আমার প্রেফারেন্স কি থাকবে? আমি হলে আমি প্রেফারেন্স দিতাম নো ট্রিটমেন্ট। তোমাদের কি মনে হয় বলো? বিং অ্যাডাল্ট এনাফ, তোমাদের কি মনে হয়? হাত নেই, গব্বর সিং যেমন ঠাকুরের হাত কেটে দিচ্ছে, হাত নেই, আর এদিকে দুটো পাও নেই, তাহলে আমার গ্যাংগ্রিনাস হয়ে গেছে, হাতও গ্যাংগ্রিনাস হয়ে গেছে। উড ইউ লাইক টু লিভ? নো। সাধারণত পেশেন্ট প্রেফারেন্স, ইউ হ্যাভ টু থিঙ্ক at the same thing. The first quadrant is the medical indication. Second is patient preference. Third is the treatment which you are giving, what quality of life you are going to give. Understand? 3 point. And fourth point, the contextual features. Contextual features, if you tell the patient to baby came here with a bilateral kidney damage from a din ani din khai kheteও পায় না, the first treatment is renal transplant. No sibling. So he has to bear at least 30,000 rupees per month for all those immunosuppressive. You have to think of the cost of that. The resources, can it be provided by them? Okay, understand? This is the four. One is the decision making. First is the medical indication. Second is patient preference. Third is quality of life after having the treatment. And fourth is contextual preferential, contextual, all those things. That is, now, if you are in a dilemma, have your colleagues discuss, ethics committee, call the ethics committee, call the legal committee, and all those things. Okay. Ethical conflicts, when there is some ethical conflicts, that can be resolved with open discussion, communication, collaboration. Discussion, and discussion. And ethics committee and mediation strategies. Every institute should have a legal cell, should have a ethics committee. If there is some ethical conflicts, you should have to entangle all those threes along with your surgical colleagues. Being an anesthesiologist, I will, the surgical colleagues, the other specialists. If a patient in a renal failure, I will ask the nephrologist to come. Okay. Informed refusal, Jehovah Witness. Have you heard the Jehovah Witness? No. Jehovah Witness is there, they will not get blood transfusion. If a patient have a Jehovah Witness, had an accident and immediately you put the patient on the water and open the abdomen or something like that and see huge bleeding and BP is down. Severely it goes down. Should you transfuse? You should not. So you have to use vasopressor, you have to use other plasma volume expander. Have you heard the term? Okay. And I don't know whether you have heard PVE, the colloids is there, the crystalloids are there, the haze, the voluven, all those things are there, or the perfluorocarbon, the oxygen carrying other, the hemoglobin that is commercially, that is not from human, the PFC, the hemoglobin carrying the fragments. Already told you regarding this. Now, inside the OT. Inside the OT, you should not breach, there should not the breach of patient's dignity under sedation and patient trust. If a patient is under sedation and if you pass anything, body shaming or comment regarding something like that, comment regarding everything, that is breach the trust of the patient and dignity of the patient. You should not pass any comment and you should prevent your colleagues to pass that. Every cadaver to a patient under anesthesia and brain dead patient has his or her own dignity and modesty. Dilemma, I already have told you, ethical practice, evolving medical required continuous. These are my references. Thank you. Another 2 or 3 minutes for discussion. If there is any question, please ask me anything about that. And I am putting the last page here with my pen. You are all, have you heard the name of Richard Feynman? Dick Feynman, Richard Feynman, have you heard the name of the great scientist? না শুনে থাকলে বলো। তো রিচার্ড ফাইনম্যানের একটা মেথড অফ টিচিং ছিল। মেথড অফ টিচিং হচ্ছে তুমি একবার পড়ালে, পড়িয়ে দেখলে তুমি ভালো করে বোঝাতে পেরেছো কিনা, যদি বোঝাতে না পারো আবার পড়ো, আবার পড়ে আবার পড়াও, তাতেও যদি না পারো আবার পড়াও। সো ইট ইজ মাই রিকোয়েস্ট, ইউ আর more than 30%, just evaluate myself.